name's Gina and I'm going to be taking care of you today. Can you tell me your name?
Anna.
What's your last name?
Keith.
And your birthday?
6685.
Can you tell me what year it is right now?
2022.
And where are you?
Cancun.
Okay, so you're alert and oriented ×3. You don't appear in any physical or respiratory distress. You're well nourished, good hygiene, well kept.
Yeah, I take showers.
I'm glad you take showers. I'm just going to kind of, head is normocephalic. There's no asymmetry or bulges in his scalp. Can you look at me? Face is symmetrical. Trachea appears midline. Looking at his thyroid, there's no obvious masses or nodules. And then to assess his thyroid, can you kind of turn, well, yeah, there we go. To assess his thyroid, I'm going to palpate from the back, and I don't feel any masses or nodules. I'm palpating his thyroid. While I'm back here, I'm palpating his carotid pulses separately, and they're equal, good strength, not bounding. And then I'm also going to listen to his carotids to check for any bruise while I'm here. Okay, you can face straight again. Take a deep breath and hold it. Okay, breathe. Take a deep breath and hold it. Breathe. No carotid bruise. I'm gonna check your eyes, okay? Okay, just look straight ahead at the light. Or straight ahead a minute. There we go. Good. Good. Pupils are equal, reactive, responsive to light, accommodation. The optic disc is present in the top of the cornea. Sclera is clear, it's white, no abnormal vasculature. Conjunctiva is pink and moist, no eye drainage. Now I'm going to assess for red light reflex. Just look straight ahead, look at the light. He's got good red light reflex, equal bilaterally. Okay, look up at me again. Cover one side of your nose and snip the other side. Nares are patent with no discharge. Nose is symmetrical. Give me a smile. Good, and raise your eyebrows. Forehead, smile, everything's symmetrical. Now I'm going to look at your ears. Give me 1 second to change this. Okay. Good. Okay, I'm going to just palpate your ear and tell me if there's any tenderness, auricle, earlobes, everything is non-tender, mobile, no masses, bulges, nodules. I'm going to look in your ears. In the external auditory canal, I don't see any erythema, scaling, any lesions. Tympanic membrane is visible. There is some wax in the canal. There's no bulging or any fluid noted in the ear. The extensorial auditory canal in his left ear is also no erythema, no scaling or lesions. And again, tympanic, I am holding my otoscope wrong. I would correct that. I would hold my otoscope like this. That's why I can't hardly see. And again, tympanic membrane is evident. There's no erythema, no discharge, drainage, no fluid noted. And then since I was holding it wrong, I would do the same on the other side. Now, lips are pink and moist. And open your mouth for me. Teeth are intact, there's no type of decay. He is missing a tooth on the back left side. Open again. Mucosa is pink. Tongue does have some lesions on it, cracking in the skin. Stick your tongue out. And some white exudate. He has been on clindamycin lately, and we are concerned for thrush, which we will handle when we would get home. I would probably give him some nystatin or some swish and swallow nystatin. Okay, now say, open your mouth, say ah. Soft palate, uvula rises midline. While I was here, I would also test his vagus cranial nerve by doing a gag reflex. Now stick your tongue out, move it side to side. His hypoglossal cranial nerve appears intact. Good. Okay, you can close your mouth. Okay, now I'm going to palpate his lymph nodes. This is preauricle, postauricle, occipital, submandibular, submental, superficial, deep cervical, and supraclavicular. There is no palpable lymph nodes. Was there any tenderness? Now I'm going to listen to your lungs. I'm going to start on your front first. And just take a deep breath for me. Good. 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 Okay, and turn for me so we can see it in the camera. Good. Great. Okay. Upon listening to his lungs, there was no adventitious breath sounds. And then upon listening, I was also palpating his chest wall. There was no masses, no tenderness, no crepitus noted. Also turn that way. And while I'm here on his back, I'm also going to palpate for CVA or percuss for CVA tenderness. And tell me if you feel any pain. No? Okay. You can turn back around. Now I'm going to assess your heart. I'm going to listen with the bell. And I'm going to listen to aortic, pulmonic, Erb's point, tricuspid, and mitral. I didn't hear any murmurs, gallops. S1, S2 was normal, and no S3, S4 was heard. Now, I already palpated his carotid pulses. I'm going to palpate his other pulses. So I'm gonna feel for the brachioradialis simultaneously they're equal, normal, no bounding or weakness. And then I would also do his femoral, his popliteal, which he has pants on, and his post-tibial, and let me see your foot, and his dorsalis pedis. Also, while I'm on his arms, I'm going to do deep tendon reflexes. So for the bicep deep tendon reflex, which I don't have my hammer, I'll just use this just to show. The bicep deep tendon reflex I would do there. Tricep I would do back on his tricep. Brachioradialis is here. And then I would do patellar and then Achilles. Okay, and also while I'm here, I'm going to test his hand strength and grip strength. Can you squeeze my hands? Okay. Now put your hands like this, push up. Okay, push down. And then we're going to do the same with his feet. Push up against my hands and push down. Good. And he has equal strength in both uppers and lower extremities. Now I'm going to test your cranial nerves. We already did his optic nerve by testing pupillary reactivity. Now I'm going to test the first cranial nerve, which is the olfactory. And let's see, what can I have you smell? Okay. Tell me if you can smell this can of Coke. You can smell it? Great. We did the optic nerve. And then I'm going to have you, I'm going to test the peripheral vision, the oculomotor, and look straight at me. And tell me when you can no longer see my fingers. You can't see them there? Okay. And then raise your eyebrows. Okay. And follow my finger from side to side. Good. And that was cranial nerves 2, 3, and 4. And then to test the trigeminal nerve, his face is symmetrical, and I would take something to test, like a piece of cotton, to test his sensation. Do you feel that? Okay. And also while I'm here, to go back to the HENT, I would also palpate for any tenderness in his sinuses. Does any of that hurt? Okay. And then I would also, okay, I already tested his, as I mentioned, his vagus nerve, his hypoglossal nerve. Now I'm going to have you shrug your shoulders for me. And that's cranial nerve number 11, and 12 was a hypoglossal. Now I will move on to your abdomen. If you can kind of lay back on the bed for me. I'm going to lift your shirt. Now notice any abdominal distension, no obvious umbilical hernia, no lesions, anything like that. I am going to listen to, first I'll listen to his vowel sounds in all 4 quadrants. And vowel sounds are present in all 4 quadrants. And while I'm here, I'm going to listen for any bruits. And I start with his aortic artery. No bruits are noted. And then his renal. And his iliac. And then I would also listen to femoral as well, here and here. I'm going to palpate for any masses, bulges. I'm going to start with his liver, and it's deep palpation, and just tell me if that hurts at all.
A little bit.
Did it hurt or did it tickle?
Tickle.
I don't feel any liver enlargement, and same with the spleen. Tell me the same thing again. No. Okay. Now I'm going to start with light palpation of his abdomen.
Tickle.
He's very ticklish, and just tell me if you have any tenderness.
No.
Again, no abdominal distension. Okay, now I'm going to do deep palpation, okay? Again. Any tenderness? I don't notice any masses, bulges. He's not having any pain. Okay. Now, let me help you up. Okay. Now I'm gonna have you stand for me. Great. And then walk towards me. He has a normal gait, no asymmetry. And then come here and stand right here. And turn and just stand real still. This is called the Romberg test. And there's no swaying or anything. He's passed his Romberg test. And I believe that's it.